Hello, my name is Chris Miller. Do you or someone you know take painkillers? Do you or a loved one have an issue with opioids? Well, I'm here to let you know there is a solution. There are some great healthy alternatives that can help get away from the side effects or the damage caused by opioids. Opioids are a drug that are usually prescribed for severe pain. They're very potent and can relieve pain quickly once digested in the body. Opioids work by binding the receptors in the brain, spinal cord, or other organs in the body, particularly those involved in feeling pain or pleasure. When they attach to the receptors, the pain is blocked and large amounts of dopamine, a neurotransmitter that plays a role in pleasure, are released into the body. Almost every day, nearly 128 people die from opioid use and overdose. Opioid use has become a very serious problem all over the world, but especially in the United States. In 2018, there were 168 million prescriptions written for opioids. The pain-relieving medication is derived from the opium poppy plant. In most forms, it is a naturally occurring substance, but in some cases, they use a synthetic form that is much more dangerous to ingest. The synthetic form is called fentanyl. It's a very powerful synthetic opioid that is similar to morphine, but is 50 to 100 times more potent. This drug is used when other people have resistance to opioids or prescribed severe pain medication. It is a high potency and is very dangerous to use and easily overdosed. There are a number of drugs that are created from the opium poppy: codeine, hydrocodone, Lorcet, Lortab, Norco, Vicodin, methadone, morphine, and oxycodone, just to name a few. There are serious risks involved with long-term use of these painkillers. They can be highly addictive and cause a multitude of health problems. The continual use of opioids can cause some serious side effects like drowsiness, confusion, constipation, nausea, euphoria, slow breathing, difficulty concentrating, higher risk of falling, depression, lower testosterone, and kidney and liver damage. Misuse and overdosing can actually cause a condition called hypoxia, which is a condition that is caused by slower breathing. Having too little oxygen in the brain can result in a lot of neurological effects, including coma, permanent brain damage, or even death. Opioids actually affect different parts of the body and the nervous system. The limbic system controls emotions, so opioids can create feelings of pleasure or relaxation. They also interrupt messages from the brain and spinal cord. Once taken, they bind with receptors in the body and turn off pain for the user. Even when you stop taking the opiates, there can be very unpleasant side effects like muscle and bone pain, sleep disruption, diarrhea and vomiting, cold flashes and goosebumps, uncontrollable leg movements, and severe cravings. Mixing drugs with opioids in them can cause an overdose quickly. Many street drugs now contain amounts of opioids, so if people experiment while using these drugs, overdose is certainly possible. Do you know anyone with an opioid problem? Well, there are definitely some solutions. While some people require the drug for pain, there are a number of healthy alternatives that can be used to assist people from removing the drug from their lives and still remove the pain. Injection therapy is one. It can help many people to relieve their pain by nerve blocks. Nerve blocks are injections that are made so it blocks the signal of pain to the brain. Joint injections are similar. They inject medication into the joints like the shoulder, knee, elbow, hip to stifle the pain. Some stimulation can assist in the pain relief. Spinal cord stimulation uses a medical device implanted near the spine that uses electrical impulses to interrupt the pain signal to the brain. Trigger point injection can stimulate the muscles and ligaments to stop the pain too. The best kind of therapy is physical therapy. Many people choose this route because there are no drugs involved and there are almost no side effects, except maybe a little soreness the next day. Manual therapy techniques like soft tissue and joint mobilization massage can be useful and helpful in getting rid of the pain. Also, manual strengthening and exercise are helpful in building the muscles and joint mobility so that the pain subsides quickly. This helps build muscle tissue and become stronger to overcome the pain in the long run. Many times, this is used in conjunction with electrical stimulation, heat, and ice therapy, and it helps to eliminate the pain and the stiffness in the problem area. If you can find any relief in these alternative techniques, it would be very helpful and healthy to remove the opioids from your body. The health benefits of removing the drugs and strengthening your body can last a lifetime and be beneficial in the long run. You can help your heart and lungs and other organs too through exercise. It'll not only strengthen your body and muscles, but many times the pain will fade away with enough physical activity and you can enjoy a normal life again. Thank you.